Thank you, Mr. Chairman. A couple of comments, I guess. The course of the hearing, I find it astonishing that some states, some governors find it a burden to take care of the most disadvantaged people in our society, that Medicaid is not something, especially when the federal government's kicking in 90% of the cost. I mean, I'm a little budgeteer from Oregon, a small business person. I'm going to pay 90% of the cost of something. I'm going to find 10% of the money to get it done, especially for this population. And who are these people? Who are these shiftless people on Medicaid? They're children. They're seniors. They're disabled people. 80% of the Medicaid population is that group. I don't consider that shiftless. 70% of the people that are able to actually work, that are on Medicaid, that little 20%, 70% of them are working. And they can't afford health care. I mean, Medicaid, 138% of poverty level, that's like what, $14,000, $15,000 a year? I challenge any of us to try and live on something like that. Afford health care? You can't do that. Oregon had a small demonstration project that at the time I thought was very good. Yeah, everyone should pay something for their health care. Oh, let's see, we sort of do that under the ACA that's being demagogued on a regular basis. Yeah, people that are lower income but can afford something, yeah, we make them pay on a graduated basis based on their income and their socioeconomic level. But somehow what we're hearing today, we don't like that because it's Medicaid. Medicaid's tougher, though. We had this demonstration project in our state, and we found that those people that are on Medicaid, they have lots of issues. They have multiple risk factors, folks. It's not like you and I that just decide not to work. There may be a few of those, but most have multiple issues. And frankly, they're not going to pay $5. And enlightened self-interest ought to dictate to every one of us, even if we don't care about children, seniors, disabled, or the people that have multiple risk factors, that we don't take care of these folks, their diabetes costs are going to go into our health insurance premium. I mean, that's been proven. That's one of the predicates over health care reform. Whether you like the ACA or not, that's one of the predicates of why health care reform is so important, to get the costs aligned like they should. And there are some good projects out there, though I agree with the general sense of this panel that the whole waiver system, the whole Medicaid system itself seems to be antiquated. And we should update it to be, I believe, outcome and results based. I agree with that 100%. That's the future, not micromanaging. Very concerned when I heard GAO talking about, well, we got more criteria here and a little more definition there and count more widgets that are being processed. That's not the goal. The goal is to have higher quality health care at, frankly, less cost. And the way to do that, and it's in the ACA, and like it or not, even without the ACA, it's coordinated care. Aligning things so you don't have the duplication that GAO talks about. Oregon has a great demonstration project that they're doing right now that I think is very accountable. It's pretty gutsy. Basically, they got a bunch of money from CMS to develop this coordinated care organizations for Medicaid patients. That means that there's primary care docs, specialists, dentists, mental health professionals coordinating the care for Medicaid patients so that they'll know what each other's doing. They'll have an accountability in there, and they're in return for this money. The goal was to keep, not only get better outcomes, but get better value, not just for the individual, but for the taxpayer. Limit healthcare inflation to 2% through the duration of it. Now, as a healthcare, as a budget guy, I helped run the budget back in Oregon back in the day. Healthcare costs for healthcare inflation 6, 7, 8, 9% annually. It was a big deal. We always budgeted more than annual inflation on a regular basis, which was anywhere from 1.5% to 2.5%. So Oregon's going to keep it at 2%. That's impossible. Well, the results so far are pretty amazing. We're under 2% inflation because of the coordinated care system. Emergency visits, I don't know about other states, emergency visits are down 21% from a couple years ago. That's substantial. Complications from diabetes down 10% already. This is the early stages of coordinated care. And chronic obstructive pulmonary diseases, hospital stays down 50%. That's what we're talking about. That should be the outcome-based type of information that every waiver should be judged by, and hopefully, ultimately, Medicaid reimbursement in general. I yield back.